Hello, and welcome to the Your Food Matters podcast. I'm Dr. Sue Kleiner. I am here with my wonderful friend and colleague, Erik Bustillo.
Hello, everybody. Hey, Sue, what's happening?
Hey, Erik. So we are back again with our podcast. If you enjoy our podcast, please share it with your friends and colleagues. Sign up for a subscription. We're on all the podcast platforms, and you can see us as well as listen to us on the YouTube Move Nutrition Network channel. So, we are here today to talk about something a little different, men's health. So I'm going to give the baton to Erik today, since he clearly represents the men's side of our conversation, and let him get going. What do you have to say, Erik?
Awesome. Thank you, Sue. Yeah, it's definitely a demographic that I'm quite passionate about helping, even though I feel that way about a lot of people, from women to men, to athletes or not. Um, but the men's health topic and conversation is one that I think is deserving of a little bit more attention. Um, and I don't want anyone to think of like me saying that to interpret it as saying we have to forget about everybody else. In no way, shape, or form am I saying that. I know in today's day and age, things can get misunderstood or misinterpreted because you support one individual demographic vocally. They think that you're taking away from the others, but that is not the case. I am still a feminist. I'm still a humanist. I'm still all those things. Um, I just feel that the male population has the pendulum has gone from all these other underserved populations getting attention as they should to forget men, like they've had the attention for forever, which is not wrong. We've had it good, if you will. I mean, don't get me wrong. Even if we're looking at like gender roles, um, some would argue that men have always done the heavy lifting, so to speak. And don't get me wrong, I mean, from a gender role, at least in the United States standpoint, like men would work and women would take care of the household kind of thing. Both of those are heavy lifting, whether you're going to work or taking care of the household. So to say that one has done the heavy lifting, I think would be unfair. But we historically have had it good because, well, we've been able to vote and do those sorts of things. Uh, so, of course, when the pendulum has swung in that direction of, hey, let's pay attention to these people, I think that some attention was taken away from men, and we need attention on everyone, in my opinion.
Here, here.
uh, so, a few things that I wanted to talk about. First and foremost, I think it's important for men to seek help. Um, we are very hard headed. I believe that ego in general is tough and can be fragile, but the male ego especially. Um, and maybe part of it is conditioning, maybe part of it is society. Uh, we were told certain things growing up, uh, be it in households or again, from a societal standpoint. But we we need to seek help. We need to seek help in the sense of um, getting an annual checkup done. I've had conversations with some patients in the past. One guy hadn't seen a medical professional, like gone to a doctor's appointment in over a decade. Um,
Mm,
and I know that saying "ignorance is bliss" can ring true to many people. But even though ignorance can be bliss, if you will, because if you want to live a blissful life, then maybe not knowing the negative things will help. But ultimately, that's just ignorance, and we definitely won't prevail with having optimal health by just being ignorant. By saying, I'll be fine, right? And that's how we
right,
were kind of brought up, right?
right.
Just rub some dirt on it or something.
Drink more
And
water.
drink more water. That's it, right? Like, not a big deal, just your headache will go away soon enough, and those sorts of things. Um, so getting that checkup, at least once a year, right? For the individuals who can, and if from a financial standpoint, if they have insurance or if they can afford to pay out of pocket to see a primary care physician, um, and in some cases, if they can't, uh, I know that there are clinics, different like public health clinics that might be able and willing to help out those individuals. Um,
Well, and the thing that's so interesting is even if you're on out on the market for healthcare, you're on your own and you purchase out on the market, or you have subsidized healthcare, prevention is part of what is covered. And so in so many of the plans, so whether it's vaccinations or a yearly annual checkup after a certain age, mammograms, for women, men, various prevention health practices are insured. And so if you catch things early through your covered health care, then the stuff that's not covered down the road that you're going to need a lot more care and a lot more expensive care for, better to grab it early and manage it and take advantage of those preventive services.
Most definitely. And I want some of the people listening to this, whether they're male or female, to take this into consideration. Like, some of those preventive tests for men will be like a testicular checkup, will be a prostate check, and those sorts of things. At the very least, in my opinion, is getting blood work done. Now, I think the unfortunate side is that sometimes when insurances are involved, some of the useful or helpful blood work may not be covered. I
Hmm.
guess maybe the doctor has to use the right ICD-10 codes or those
Right,
sorts of things.
right.
Um, but it's also important for men to have things like their hemoglobin A1C tested, have their PSA tested. It's a non-invasive type of way to check your prostate, and use that comparatively, because one PSA may or may not be helpful, but the idea is to use the PSA from last year to this year, or this year to next year, and compare them.
And just if you could tell us, what is that PSA test? What is that checking, Erik?
So it's measuring for any changes in the prostate specifically, right? So a lot of times what will end up happening is, um, PSA stands for, if I'm not mistaken, a prostate specific antigen.
Right.
Um,
So it's an indicator of risk of cancer.
Yeah. So what would happen is, and this is why we want it to be comparative. There could always be false positives. So I've seen blood work come back and it was high. They remeasured and it was normal, and remeasured again and it was normal. So that can happen. Um, but like, if the PSA goes from zero point 0.9 up to 7.3 from one year to the next, that's kind of like, okay, let's absolutely redraw this and check it again. At
Right.
least this is what, in my opinion, a responsible healthcare practitioner would do. Uh, Remeasure, see what's going on, and then take the appropriate steps from there. But I think it's important for people to keep this in mind. And there's also other tests that I would recommend, like testosterone and estrogen, among other things, for men to get done. But the blood work is so important. But one thing that we have to keep in mind as practitioners is, we don't necessarily just treat blood work. We treat, more than anything, the patient, the person. So we have to listen for symptoms, right? So a lot of times, if someone is complaining of something, I think that medical professionals can be quite dismissive for both men and women, and we have to vocalize that. Like, when I work with patients and clients and they're going to go talk to their doctor, maybe it's a specialist or whatever it is, I make sure that they go in there feeling comfortable with having a conversation with them, and not just getting bossed around or even bullied around and fat shamed in some cases and whatever it is. People have to go in there and advocate for themselves. I've even offered to go with people to their medical appointment. Only one
Wow,
person has
good for
actually
you.
taken me up on that. Yeah, for sure, for sure. But I think that people need to recognize, like, it's not just about the blood work, because there might be symptoms, and then the doctor might just kind of be like, "Oh, look in the face, look at this. Oh no, you're totally fine. It's just a headache, or it might just be stress related. Like, you'll be fine. Take a couple Advil, and I'll see you in a year or something." It's like, no, no, no. Listen to yourself and advocate for yourself as the patient, because sometimes people can be dismissive of these sorts of things.
Yeah, for sure. I mean, we talked about the story of, in my family, I'm not going to get too specific, but there was a case of pain and at the same time, benign prostatic hypertrophy or BPH, where the prostate starts to get enlarged. It interferes with the flow of urine, and sometimes your bladder can kind of feel very full, but it's not really emptying very well. It's a discomfort that is not uncommon as men begin to age. And this person went to a urologist, so a specialist. Urologist said, "Oh, it's just BPH, meaning this enlarged prostate." Well, but I have pain. Is pain a part of that? Well, not necessarily, but I don't think it's anything. We go to, they go to the next urologist. And in fact, after three urologists who blew him off, it became a really bad prostatic infection, prostatitis. Ended up in the emergency room. Could have had sepsis. It was a very dangerous situation, a truly life threatening situation. And so this is one of those situations where the urologist, so used to seeing men coming in with enlarged prostates, blew off the pain, even though pain was kind of inconsistent with that diagnosis. And so I I'm right there with you in really advocating, your body. And the
Yeah.
doctor is not inside your body, doesn't know what you're feeling. If something's really wrong in your mind, keep pushing.
Absolutely. We definitely have to advocate for ourselves and our loved ones. And if you're a practitioner listening to this, please, keep your patient in mind, right? Or your client in mind. And so that's definitely something that I think is important to do. But also there's a little bit of a why behind that, as far as men, and sometimes men not doing it. Uh we're told to suck it up. We're told, boys don't cry, whether it's literal crying or don't complain about things.
Mhm.
Now, don't get me wrong, I definitely think that there's certainly a time and place for men to be strong or hard, if you will. Um, at the same time, that doesn't mean that we should discourage the complaining of pain, physical pain, and those sorts of things, because that can manifest into something else. We don't have to hold it in, right? We have to be able to talk about
Right.
these things with a professional. And you would think that the doctor is someone that would do that and would hopefully listen and look for some kind of like natural route, as opposed to just trying to prescribe a medication. But it's having the right people in your corner when it comes to that. So, uh, uh, the historical thought process of, boys don't cry, just toughen up, man up, kind of thing. There's a time and place for that. But when it comes to our health, I'd say most of the time it's not gonna
Right.
be that.
So, are there any sort of recommendations or guidelines for things that are, they may not be particular to men's health only, but that they manifest differently in men and boys? Things that they can do, preventive nutrition or exercise practices, things that can, help support better health.
100% without a doubt. To me, the first thing that I would want to talk about when it comes to that is taking care of your physical health. Um, I really can't emphasize it enough how movement is a form of medicine, not a literal form of medicine. Like, you're not taking movement or exercise. Um, but we should definitely practice it in doses and that sort of thing. Um, so, as far as lifestyle components and things that we can do, nutrition plays a huge role in men's health. Um, the first thing that I typically encourage men to do is make sure that they are eating enough. And when I say eat enough, that means don't overdo it, but don't underdo it either. Like January comes around and you go on this fad diet, crash diet kind of thing. It worked for me, years ago, and it's worked for me every year. I lose this and that, but slowly but surely, it starts working less and less as the years continue to pass. Um, so finding something that is truly sustainable. It's not sexy. It might be boring. It's probably going to take time, but we have to kind of push off instant gratification if we want long-term health. Um, so making sure that we are eating enough calories in general, but then of course the what becomes important. It's not just make sure you're eating enough calories in chocolate chip cookies, right?
Although
That's
that would be really fun
for sure, most
for a day or
definitely. But
two at least.
exactly, because then eventually we start feeling sluggish and whatever else. So um, I'm definitely a protein pusher. So making sure that men are getting adequate amounts of protein on a regular basis is extremely important. That's going to be one thing. And again, most days, maybe most meals, right? Maybe approach it with like an 80-20 approach. 80% of the time, doing what's best and optimal for me. 20% of the time, it's okay to indulge, or sometimes things are out of our control. So controlling the controllables, whether it's nutrition, health, and all of that, we want to stay on top of that. Um, After protein, or I shouldn't say after because they're all going to be important, is making sure that we're getting enough fat. The underconsumption of fat can have a negative impact on our hormones. So a lot of times when I'm working with men, and they're kind of like, this diet, that diet, and I'm just like, listen, just make sure you're eating enough. We can figure out what that is. Get adequate protein, and you don't have to go full on keto, but also make sure that your calories from fat aren't getting under maybe 20%, because that can start having a negative impact on things like testosterone, which a lot of men are so concerned about testosterone. Um, so that's going to be the next part. And then, of course, carbohydrates. Carbohydrates can be programmed into our diet depending on specific needs, from physical activity to caloric needs. But I had a patient one time who he was going on a very low carb type of diet program, being physically active, all these things. Was testosterone was maybe at a certain level, and I forget the exact number, but either way, I helped him out with his nutrition. We tweaked it a bit. We did increase his carbohydrate consumption a little, and sure enough, he reported feeling better, energy levels and numbers improved. His cholesterol improved, and his testosterone also went up some. I don't think the testosterone was terrible, but it did go up. Now I take that with a grain of salt because the blood work is it's just like a snapshot
Mm-hmm.
as to what's happening with those hormones at that point in time. But it can still be helpful. Either way, he reported feeling better and all these other things. So I was happy about his progress there.
And the mental health side of this really is important too. So of course, if your testosterone drops, your mood, your mental energy, your ability to focus, and your physical energy, all of that, libido, everything kind of goes down the tubes. And the the interesting thing is it's not just, as Eric's saying, total energy intake, but it's also the amount of fat and the amount of carb in your diet proportionately to your calories has been associated with mood. And so, um, carbohydrate in particular, people who have a tendency toward depression, when diets are lower than 40% of total calories from carbohydrates, which is so prominent right now with the, sort of adoption of keto style diets. If you have a tendency toward both low testosterone, but also depression, then a low carbohydrate diet is not good. It increases the risk of incidence of depression with diets lower than 40% of total calories from carbs. And the other is fat. And so here we have, it's this multifunctionality of nutrition is sort of the mastermind of how the human body works. And so fats do so many things. Diets that are less than 20% total calories from fat, in people who have a tendency toward anxiety and inability to cope with stress, it decreases their coping skills and their coping mechanisms. So fat not only is super important for your maintaining good testosterone levels, for so many other functionalities in the body, but also brain health, mental focus, and mood and coping with anxiety. So more fat is better in that sense. But when it comes to men, and part of this focus on women has elevated our consciousness toward the risk of heart disease in women postmenopausal, but men have always had in younger ages a higher risk of cardiovascular disease. And so where does fat and carbs and processed foods and all of that fit into that profile?
Yeah, as far as the processed food side of everything, um, I'm a huge advocate for moderation, and I like to remind people that moderation, there's not a specific definition for moderation as far as amounts when it comes to food. Moderation will look different for everybody. And of course, in having conversations with people, reminding them moderation with alcohol is going to be important. Moderation
Right.
with those processed foods are going to be important. Um, so being able to practice moderation is huge, and again, it's going to look different for everyone. Um, the the getting of adequate nutrients through this variety of foods and hopefully preventing things like heart disease and those sorts of things, men, for whatever reason, and I can come up with some hypotheses on this, but we have a tendency to not eat vegetables and fruits, at least not on a regular basis. Um, and that's where we get a lot of a variety of nutrients coming into our diet. The more color, the better, because it means more nutrients coming into our diet. So if anyone listening to this has this one takeaway, is just incorporating more color into their diet, that can make a huge difference. And it's a simple concept. um, by making sure that we're fueling properly, so we will by default typically start feeling better, and then that will also help with physical activity, which is also huge, a huge part of men's health all around. And it's not just one thing of physical activity. People think like men should be lifting weights. That's not wrong, in my opinion. But we also shouldn't forget about the aerobic side of things,
Mhm.
right? For cellular health, for mitochondria, right? For cardiovascular health, aerobic exercise and training is going to be extremely helpful. Um, and then, of course, the resistance training, supporting muscle mass in the long run, because we're at risk of losing muscle mass as we age, just humans in general. Maintaining strength and quality of life. So making sure that we're keeping up with that is going to be huge. But then, even outside of the nutrition space and the physical training space, we have to remember that sleep is extremely important.
Mhm.
Sleep is when our body kind of resets itself. It's literally getting rid of waste products from our brain as we're sleeping, like a detoxing, if you will. And if we're not getting adequate sleep because either work or we stay up super late watching TV or on our phone or something along those lines, now we're running this risk for uh, uh, a potential negative impact on our hormones. Um, and you take all of those things and mix them up, and if we're not doing them optimally in the best way for ourselves, then that could have a negative impact on other things, because like we know very well that loss of muscle is a problem, and that can have an impact on things like type 2 diabetes and activities of daily living. But there's also something to be said about increased body fat that can have a negative impact on things like increased risk of depression, increased risk of cancers, um, increased risk of poor mobility, and those things, among other things. Our hormones going to get affected, testosterone and estrogen. So I think people need to start thinking about the fact that there's more to our health than maybe just like, hey, just go for that walk. Yeah, definitely go for that walk, but there's more to it, and this is some of the why.
You know, and you were talking at the opening about sort of the cultural changes over the past, you know, 50 years, 40 to 50 years, and especially I'd say in the past 30 years of the role of men in society and in family life. And I may not be a man, but I have lived with one for 42 years, aside from having a brother and a father and a grandfather, etc. And and that role, yeah, I really did watch change. I mean, that has been within my lifetime. And husbands, as you said, used to go to work and come home, and I'm not, certainly never everyone, but the average role was that the wife took care of the household, the family, etc., and men were free to do whatever they wanted to, um sort of after work and that sort of thing. But today, I think most families, the father is or fathers are equally involved in home life as their work lives, because their partners are also doing the same. They may be out working as well as in charge of home life. And so in my household, um, it's usually around in your 40s and 50s is when the stress of work really starts to take over. You've moved up, or you're moving up in your career, or it's your family is getting older and the financial stress is increasing because the financial demands increase as if you have children. Things just get more expensive. And so you are spending more time at work, and then you feel this demand or need or obligation to get right home, to then be with your family and contribute at home. And that's what happened in our household. I always worked from home. I have always worked, but I was really the person at home, and my husband was out working. And as he hit kind of his 40s, he wasn't exercising as much. And he'd say, I need to get home. Like, if I don't come home right after work, and I go exercise, well, then I'm an hour and a half later to get home. And the kids are by then almost ready for bed. And I don't want to miss that. I need to be home. I need to be there. And my response, and probably because of the field that we're in and the knowledge that I have around men's health, I said, well, with the stress that you have in your life, uh, if you if you go to exercise after work and you take that extra hour, well, then 3 to 4 times a week, we miss 3 to 4 hours of you being home and in our lives, versus you being gone completely 10 years from now because you dropped dead from a heart attack. And so I vote for the extra couple of hours a week that you take to go work out after work and come home, versus not being here with us for many decades to come. And that was my comfort zone, my solution, because I know that is reality for a lot of men.
Absolutely, and that has to be a part of the conversation, and in my opinion, the culture shift. Uh, People, partners have to support each other. We have to be willing to take care of ourselves as well. Like a better me is a better we. So if I'm taking the best care of myself, I can take care of my significant other, my child, my parents, whoever it might be, my patients, my clients. Um, but there should be a culture shift in that. And that's some of the stuff that, because me being involved in corporate wellness, that's a part of what I try to implement as part of our corporate wellness programs, to have people recognize, like, hey, you got to take care of yourself. Your health has to be a priority. And it's finding ways to basically convince people to do that. It has to be a part of the conversation. It really does.
Right.
So the fact that in your household you guys were able to make that happen and make that work, I mean, that's wonderful. um,
We kind of split it. So I am an early bird, and I would get up and go to the gym at 5:30. My husband would then leave for work at about 6:45, and that and then I got my workout in, and then he would go after work. And so, like you said, it was a negotiation. It was saying, I need to do this for my mental health as well as my physical well-being, and for us to be the best that we can be for ourselves, for each other, and for our children. um and I want to be healthy into, late in life. And while you can adopt these practices and improve your health at any point along the way, the sooner you start, the more likely you are to be healthier as you age.
yeah, and I like to tell people it's hardly ever too late to start, but it's never really too soon to begin.
Exactly.
um,
Exactly.
I and I like that you mentioned something about like the mental health component and all that. This was the last point that I kind of wanted to talk about, um, is being able to manage stress and mental health. Stress management is such a huge part of long term health, and I think it's important for men to think about, like, we're expected to perform. We're expected to do well in our jobs, to make money, to be strong, and put our people on our back if we have to, kind of thing, literally or perhaps metaphorically speaking. um, but it's important to take care of that stress part of things, um, because imagine trying to, I mean, for us, our relationships are important. Like, to me, like, the people in my life are extremely important. My significant other, my parents, my brother, like, like my brother's little family, from the niece and the nephews, and my friends that I'm close to, and I got to be able to perform for all of them. So I think men have to really take this into consideration, that you might not be able to perform your best at work. You might not be able to perform your best in the bedroom. You might not be able to perform your best in any of these things if you're not managing stress the way that you should be, because that is just going to add another weight to your psychology and all of that. So we have to be able to talk with people. There's strength in community, right? Feel comfortable in talking with your partner. Talk to whatever support system you might have. And if you might not have one, look for one. My brother and I, down here in South Florida, we started a men's group that allows men to gather and talk about things that they might not feel comfortable talking about to other people. But we built this safe space. So we work out together, kind of suffer together, bond through that. And then we talk about things.
Awesome,
And
Erik.
for sure, I think we need more of that, And this isn't something that, like, I promote a whole bunch or anything, but who knows, maybe one day I will. But I think people need to know that there's strength in community, because I'm going to read some statistics, because I posted something on my social media um, a few days back, because it was International Men's Day. And generally speaking, you hear about the International whatever day. It's Peanut Butter Day, it's Women's Day, it's Hispanic Heritage Month, shout out to the
Grandparents'
Hispanics.
Day. Yeah.
Exactly, all those things. National, Donut Day.
Right.
I
Yeah.
heard zero. I heard zero about International Men's Day, and like nobody messaged me saying, "Hey, happy New." And I don't ask for that stuff, but I'm like, no one is even talking about this. So some of the things that I posted, some statistics here: 76% of suicides are men.
Wow.
85% of homeless are men. 70% of homicide victims are men. 40% of domestic abuse victims are men. Men on average serve 64% longer in prison. men on average are 3.4 times more likely to be imprisoned than women when both committed the same crime. Um, there were a few other things as far as facing just longer sentences. Boys get lower grades for doing the same work as girls and are also punished more harshly for the same behavior. Um, at work, men dominate just two of the 15 job categories projected to grow the most this decade, and roughly one third of US men are either unemployed or out of the workforce. Men and boys lose their right to autonomy and equal protection by being forced into gender based conscription all over the world and make up more than 97% of all military deaths. Globally, hundreds of millions of boys lose their right to bodily integrity through needless genital mutilation, whilst 115 million boys are forced into child marriages. And it's just kind of like, in some cases, like turning the script around, because we focus so much on women when we see statistics like this, as we should focus on women. But how about the boys or the men's side of it? And I saw this was, I posted this. Oh wait, did I post this part? I don't know if I did or not. But I saw it and I was just kind of like, wow, is this really where we are? Um, it's it's like a cover of, it looks like an online magazine, and it says the title: "We need International Men's Day about as much as White History Month or Able Body Action Day." I see this and I'm just like, that's just ignorant. That is just terrible. So, and this person, there's a quote from them, and I'm not going to say their name because I'm not trying to give anybody credit or anything. It says, "Being a man is its own reward. You hit the jackpot when you are born a boy child. Yes, within your group, things are tough for all sorts of reasons. None of them are because you are a man." And this is the thought process that I think has kind of pushed men into a particular direction of feeling like they can't ask for help, of feeling very isolated or remote. But we have to be able to help each other and talk about these things, because inequality is a shame, and there should be equity on all fronts, and that goes for men too. Just because a particular group has had it really well for a large part of time, and people will say, the patriarchy and those sorts of things, and I'm not going to disagree with that, but it doesn't mean that we have to start treating them poorly or just completely forget about them. Like, everyone is important, and we should really start treating people that way.
I agree. I think very well said. It's as if it's your fault that women were an underclass. It's your personal fault, your personal responsibility. And so you should go without because because of where we are culturally. And so I don't agree with that either. And I think every individual has the right to wellness and healthcare and safety and security and all of those things. Um and no one should be like disrecognized
Yeah, for
because
sure.
another group is. I mean, that's a false equivalency, right? I mean, it doesn't. It's like when the mean, I remember when I was little and my mother used to say those kids are mean to you, because when they put you down, it makes them feel better. And so it's kind of like it feels like that, like by dissing you, disrespecting you, it elevates another group, and that's just not reality. So um I guess my last point is that as things have changed, as cultural norms have changed, we may not have as much data on especially young men as we think we do, because especially in the area of stress, because we know that in other countries, as we have watched cultural changes around women more recently, and you and I have spent time in Vietnam, and we're well aware of the health consequences on women in Vietnam, as they always had a lot of responsibility in the home. Once they got married, they were responsible not only for their own family but for their husbands' families, in multi-generational homes, now those women are also expected to go out into the workplace and still retain all the responsibilities at home without a change in the norms and responsibilities of the men. And so the women have just taken on more and more and more with no cooperation in general for care in the home from their spouses. And so we have watched women's health degrade in Vietnam. Well, who knows what's happening here? I don't think that we have data. At least I haven't seen it. And I have to say, this is not my area of expertise. It is purely a question that as men have have opened their roles to both in the workplace as well as at home, regardless of who their partner is, two men, a man and a woman, doesn't matter. It's the individual taken on responsibility and actual hands-on at home as well as in the workplace, and especially if they're working from home and responsible for what's happening at home as well, just like women. What is the current status for men in their 30s, 40s, and 50s? What are the data uh, on them? And so the notion that we know everything about men that we need to know, let's put that in the closet and only focus on women, is just probably frankly wrong, let alone naive and short-sighted.
For sure. And there's definitely been a shift in the workforce with those things, with men being able to find work, being able to afford, a living, being able to afford something like school, perhaps, if they can even get into school. And then if they don't get to school, are they able to find work? It's just this vicious cycle of things. And there are some statistics on that, and I don't know them off the top of my head. Perhaps, for a part two one day, because I mean, I didn't even talk about, micronutrients and supplements and body dysmorphia and body image issues and eating disorders amongst men and boys and those sorts of things. There's just so much to unpack. Ultimately, though, we got to find help. There's strength in community. And I like what you said. Like, we should never, in the pursuit of making ourselves good and big, if you will, we should never tear somebody else down to get ourselves there.
Yes. Yes. Perfect ending. Well, Erik, it sounds like we're going to have a part two, so I'm good with that. And uh, we are so glad for those of you who have joined in. If you have enjoyed this podcast, please share it with your friends. This is the Your Food Matters podcast. I am Dr. Sue Kleiner,
I'm Erik Bustillo.
and we are signing off for today. Take care. Bye,
Thanks,
Erik.
Sue. Thanks, everyone. I'll see you soon.